Well, good morning, everybody. Welcome to 2024. Happy New Year. My name is Robert Crowder from the Benefits Trust, and I'd like to welcome everybody. An exciting day today. We're starting off our new year with new CE sessions, and we're back as I like to say, week 1.5. A lot of people worked last week, but a lot of people certainly didn't, and now we're back at it in full swing. So we'd like to welcome you all today on behalf of all of us at the Benefits Trust. Because we're excited. We're excited. We just celebrated our 30th anniversary. Benefits Trust started on January 1st, 1994. And so this is our 30th year, and we're getting bigger and better and stronger every single year. And we're excited about it. Here from the Benefits Trust is Carrie Lane. Carrie is going to give us a shout out. There's Carrie. Mike Ignatz is with us, as well as Rob Crowder, my son. And a new addition to our team, the 1st of January, is Lindsay Gibson. Many of you for the industry. So welcome, Lindsay. This is the first time you've been on this side of the camera, so to speak, if you would. I know you've participated in these in the past, so welcome. Thank you. I want to remind everybody as well that participating today, and please leave your cameras on. For participating today, you're going to get a CE credit. So Mike is going to be sending out those CE credits really shortly after this call. As well as that, you're going to be signed up for our Trusted Advisor newsletter that comes out every single month. Many of you I know already get that. But if you're new, first of all, welcome. And secondly, you get signed up for our newsletter. As well as that, we're going to send you out a really short survey. And that survey is going to tell us how we did today and how we can do it better tomorrow, as well as give us future topic ideas that we can cover in future Zoomcasts. I know we've got a number of Zoomcasts scheduled throughout the year, but our next Zoomcasts are going to be in February, and they're about, the topic is building a bulletproof sales plan. So some exciting stuff coming up. And when we started these Zoomcasts, really was back in 2020 when everything was shut down with COVID, and I hate talking about COVID, so let's make it I'm going to make it my New Year's resolution not to talk about it anymore. But anyways, back in 2020, we started these things because nobody could obviously go anywhere. And I'm happy to say that it's exciting. We've got, quite a few with the 3 sessions that we're doing on this topic. We've got quite I think about 180 people signed up for it. So we're pretty excited about that. But the best part about it is, these things work. It's not about being the smartest person in the room. It's about being in a room where everybody gets smarter. And that's the best part, or one of the best parts about our industry. And I think the presentation that we've got ready for today, I think is going to be exciting for many of you. And I'd like to take this opportunity to welcome our guest presenters today as well. That's Kevin Brady and Matt Brady, and I'll introduce them more a little formally in a few moments. So again, it's not about being it's not about being the smartest person in the room. It's about being in a room where everybody gets smarter. So let me share my screen here, and let me do this. Just want to make sure I get the right one. I think this is the final one. Can everybody see that okay?
Yep.
Yeah.
Excellent. I'm really good with technology, not. So anyways, it's about real executive benefits. That's our subject today. And I want to talk, briefly about the Benefits Trust, although this is not a commercial. I want to talk about owner executive benefit plans. I want to introduce Advica Health and Kevin and Matt Brady. We want to talk about adding real value as well. And then, of course, have a question, answer, and discussion period. If you've got any questions throughout the presentation, just throw them in the chat box. And I know Lindsay or Rob or Mike or Carrie would be able to answer those questions for you, as well as that. If they don't have the answers, we'll certainly get them for you. So about the Benefits Trust, as I mentioned, we started on January 1st.
A claims investment assessor.
Hey, Gordon,
Regarding,
can you mute yourself? Rob, can you do that, please?
Yeah.
With a whole lot of claims. And I got an email back from a Buchanan cat.
Hey, Rob, you got to unmute yourself. I muted everyone.
There we go. So the Benefits Trust started on January 1st, 1994. We are a full-service third-party benefit administration company. We are the largest independently owned TPA in Canada. We provide custom employee benefit solutions. We work with advisors like yourself. We spend, since since April 1st, 2001, we have had the opportunity to work exclusively with advisors like yourself. So we're pretty excited about that. Our clients tell us, because of the surveys that we do from time to time, that we've got exceptional client experience and client service. As I like to say, we do the 5% extraordinarily well. We pay claims, we send out bills, we provide customer service. Everybody does that well, right? But it's the 5%. It's where people have problems that I think that we do really well. I had an experience with Rogers over the last couple of weeks, and we've spent hours and hours and hours on the phone. And it's just amazing because they can't do that 5%, but we do that extraordinarily well. Long-term business relationships with all of the major insurance carriers and service suppliers. And our target market is really working with you as professional advisors with clients with a few to 100 employees. We do have many larger clients, but really that's our target market because that's where Canadian business is. So that's the only commercial I'm doing today. The rest of it is talking about executive benefits. With my 34 years experience of being a licensed insurance agent or licensed insurance advisor and 30 years of the Benefits Trust, I think I've had over 10,000 sales meetings in this space, dealing with business owners and executives. And one thing that I've learned, or a number of things that I've learned, but one of the things is business owners and executives hate paying taxes. I know many of you in the room today are very highly compensated, or you make lots of money and you're a business owner and you hate paying taxes. We know that you have to do it, but you hate doing it. It's as simple as that. The other thing is, as a business owner, and every business owner that I've spoken to as well, they hate wasting money. They don't mind spending money. They hate wasting money. They hate wasting money. And it's amazing when a business owner feels like they're wasting money, they're willing to make changes real quick when they're wasting money. As well as that, one thing I found is business owners hate insurance premiums. They know it's a necessary evil. They've got to buy life insurance. They buy living benefits. They buy insurance for their houses and their car and their art and their jewelries and all their toys and their cottages and their chalets and whatever they have, but they hate paying the premiums. They hope to never use the insurance, but they hate paying the premiums. And the other thing that I have found over the 34 years of experience in this space is business owners and executives, busy people, hate waiting for appointments, medical appointments. They can't stand it. So that's what we're here to talk about today, is we're focusing again on business owners and executives and keeping in mind, taxes, keeping in mind value for money, keeping in mind, insurance premiums and paying insurance premiums and waiting for appointments. And I think that's what we're here to talk about today. So let's take a step back. And just look at what, from a 30,000 foot level, what a benefit plan is. And a benefit plan is nothing more than a promise between an employer and a group of employees. If you've been on these presentations in the past, you've heard me say this, but I say it every single time, right? Benefit plan is nothing more than a promise between an employer and a group of employees. So you got to ask your client, you ask your prospect, ask your client, what are the groups within your group? And I don't care if you've got 3 lives or 10 lives or 100 lives or 1,000 lives. There are different groups within the group. At the Benefits Trust, we've got 30 employees, and there are very much different groups. There's a sales department, there's an executive group, an ownership group, there's an administration group. There are a number of different groups within the group, depending on what lens you're looking through. So all clients have groups within the group. So I think it's important to ask that question. And there we go. And you can help them along, their office staff, warehouse, sales and marketing, management, professional. There are different groups within the group. But one of the groups, and I like to say this, is the owners, partners, founders. Those particular individuals are the decision makers, or ultimately the decision makers. And I like to say start at the top. Start at the top. And because those are the folks that are making the decisions. Those are the folks that hate paying the taxes. They hate waiting for medical appointments, right? They hate wasting money. They want value for money, and they hate paying insurance premiums. So you can address all of those things when you're talking about benefits, and especially when you're talking about executive benefits. So let's start at the top as opposed to, looking at these different groups. Executive benefits, in as few as one life. One of the things that we like to say is for executives, and I think there's 2 types of business owners and executive owners, if you would. There are two types. There are profitable ones and there are other people's prospects, right? But the profitable profitable businesses, if you would, one of the things that we always recommend, that advisors recommend, is a 100% unlimited plan. It's a fully budgeted ASO plan, but it's 100% unlimited. 100% unlimited for vision care, 100% unlimited for appliances, 100% unlimited for drugs and dental and adult orthodontia, everything, because it's just a tax play. It's a tax effective solution for business owners. We offer a claim secured drug card. We offer stop loss and out of country emergency travel coverage for 30, 60, 90, 120, 180 days. So depending on what their requirements are, I know a lot of owners travel to other provinces or other countries, for extended periods of time. Yes, they're still working. They're still working every day, but they're living in other places. As well as that, we like to provide monthly reporting so there aren't any surprises at renewals. And, this gets their attention. It gets their attention. They see where they're spending, we see where they're spending, or we see where their spending is, and it gets their attention. So there aren't any surprises. And one thing that we find and getting feedback from a lot of our clients is this is a better option than Cost Plus. Cost Plus, and we can, if we have time at the end, we can talk more about that. But it's certainly a better option of Cost Plus because you touch the claim once, it gets submitted, and it gets paid at 100%. This gets the owner's attention, without a doubt. So some of the eligible expenses on an owner's plan, can include things like prescription drugs, dental, obviously, but the dental work can include crowns, implants, adult orthodontia, and so on. My wife had a problem with her jaw, and anyways, she needed some teeth removed, but she had 6 crowns, and it was all done within I think about an 8 or 9 week period. So the dental bill was quite a few $1,000s. Other eligible expenses include private rehabilitation facilities. We get asked this question a lot, right? Because a lot of people need rehabilitation, and public rehabilitation services aren't really available. And private rehabilitation facilities are considerable amounts of money and can be included in a benefit plan. Specialized private school tuition. If you've got a child that has a special need or learns differently than others, and you can go to a private school that specializes in that type of teaching, that is an eligible expense. US or worldwide specialized healthcare, medical appliances. So for example, as many of you know, I'm a skier. I have 2 knee braces, not because I have one for each leg. I just use one here in Ontario, and I use one when I ski out in British Columbia, so I don't have to carry it back and forth. Vision care, I've got 3 pairs of the same glasses, right? All of these things are eligible expenses. And we've just had our first, we had a client late last year, because of mobility issues, install a $180,000 elevator in their house, right? 100% eligible medical expense. It went through their benefit plan, tax deductible expense as opposed to a after-tax expense. So in other words, this $180,000 was a deductible expense to their business, instead of having to take out $360,000 in earnings to pay $180,000 in tax and then pay for that elevator. So there's an awful lot of opportunity there. So when we're talking about executive plans and creative plan designs, when clients have that creative plan design, that 100% plan that we're talking about, these real executive benefits, they tend not to look anywhere else. The plan will actually work for them and meet their specific needs. Not everybody's getting a $180,000 elevator, but they might get those 3 pairs of glasses or whatever it is that makes sense in their world. So they understand that it meets their needs. It's kind of like buying a custom shirt. Once you buy a custom shirt, it's hard to buy off the rack again, especially if you're a unique size or a portly gentleman like myself, right? It's easier to buy, a custom shirt, and, it's better than buying one off the rack. The other thing I've learned is, a lot of people spend a lot of time to try to save money. But I think successful executives and successful business owners are willing to spend a lot of money to save time. And that's really the philosophy. They're looking for ways to save time. And when we're talking about things like, with successful business owners, we're talking about things like waiting times for appointments. They're not willing to do that. They're willing to spend a lot of money to save time. And that's sort of the mindset shift that I want you to look at when we're going through this presentation. It's about successful executives that are willing to spend money to save time. That's where you, as a professional advisor, can add a great deal of value. So at this point in time, I'd like to introduce Kevin Brady and Matt Brady. They're the founders of Advica Health. It was established in 2007. I've known Kevin 25 years, I would say, at least. Yeah, it's amazing. I've known Kevin for 25 years. You sold your practice, your benefits practice, a number of years ago, and a very successful practice. As a matter of fact, when I first met Kevin, I said to myself, one day when I grow up, I want to have a practice like Kevin's. And just an amazing practitioner and an amazing guy as well. And it was interesting in talking to Kevin about Advica Health, and we've talked about it a number of times since 2007. But this Advica Health was created, I think, out of a strong passion that Kevin has. He knows the benefit world inside and out, but saw a gap and saw a huge gap. And this was really the passion that made this made Advica Health what it is today and how it's growing. And Kevin and his son Matt have built this great company, and they've now got thousands upon thousands of members that are using the service. They're going to tell you an awful lot more about it and how it can add real value. But just on a personal note, I purchased this service for myself and my family, and my middle son needs, a ACL. He needs ACL surgery for a torn ACL on his knee. And in Alberta, where he lives, the waiting time was somewhere between 12 and 18 months. And we signed up for the service with Advica Health. We bought an annual membership in the service, and we'll continue. And I don't know, something magical happened, but he's having the surgery within 5 weeks. So 12 to 18 months, 5 weeks, and he's having the surgery done in the town which he lives, and that's Banff, Alberta, with one of the top surgeons in the country. So to hear more about Advica Health, it's not me, it's about Kevin and Matt. I'm going to pass it over to you guys. So Kevin, Matt, welcome, and thank you very much for participating today.
Great. Thanks, Rob, and great to see everyone this morning. And Rob did share the background, so I'll just get into that a bit because I think it's important just to share my story as to why I created the company. But as Rob said, I've been in the benefits field, I think a little longer than you, Rob, almost 39 years. So I know it inside out and backwards. First of all, on the corporate side. And then as Rob mentioned, I started my own employee benefits consulting firm in 1998, grew that across Canada. But the reason I started Advica Health is through my course of working with business owners and executives, when they had health issues, they would reach out to me. People like yourself or business owners, executives, they would reach out, and I would use my connections at MedCan or Cleveland Clinic or Mayo Clinic to help get them through the system. And it was actually a customer that's still a customer today that half jokingly, whenever I see him, he says, "You saved my life." And I didn't personally save his life, but through some of the advanced testing I'm going to talk to you about today, we were able to determine that he had stage 1 kidney cancer. And I'm not sure if anybody has had any experience with kidney cancer, but with kidney cancer, unfortunately, when it shows up, it's usually a secondary cancer, and it's usually stage 3 or stage 4, and then it can be fatal. So through advanced testing, we were able to find that he had stage 1 kidney cancer. We were able to get rid of it, get it blasted out, and and he was back to work, and he's still a customer today. But and that's when I thought, there's got to be somebody in Canada doing health navigation, and this is a number of years ago. So I put together a request for proposals, and I went out to the marketplace, and there was nobody doing health navigation. So I went out and hired a nurse, as Rob said, to fill a need in the void in the marketplace. And what I noticed with it, and I did it more as a service to my benefits customers, but what I noticed was it just started growing by word of mouth. Because what do people talk about? As Rob mentioned, people talk about how long they're waiting in the system, how they're stuck in the system, how they're waiting 6 months for an MRI. And one of our members would say, oh, I got in 3 weeks or 4 weeks or a week. And they, how'd you do that? I was a member of this program. So I actually sold my benefits, employee benefits practice to really focus on this, on Advica Health, and pleased that my son, Matt, joined us a few years ago. We are now coast to coast across Canada. We have doctors, nurses, over 1,000 practitioners, which I'll get into shortly, in every single province across Canada. And what I would say is, I believe this will be a huge differentiator for each of you. And the fact that Rob is now offering this and his company through Benefits Trust, this will be a differentiator for you in the marketplace, because we are the only ones doing this in Canada, and this will give you a leg up instead of just, you know, the typical, well, we can save you money, or I think what Rob's created is an amazing company and very intuitive to the marketplace. This will give you something else that you can do to differentiate yourself in the marketplace. So I'm going to start off here, and then Matt's going to take us through our programs. But our mission is pretty simple. It's to help people live long and healthy lives through our expert navigation. As I said, we have over 1,000 specialists we deal with in Canada. And instead of, think of yourself when you've got a health issue and you have to think, where do I go? Who do I see? What's the best way to get this treated? Our members, simply through calling us or contacting our team, we've got that figured out for them. Like, we know who the best is and how to expedite the service. And our vision is to help Canadians access the best healthcare solutions through our leadership and expertise. As Rob said, we've got over 100,000 members now. Our goal is to help 1 million members and eventually 3 million in Canada utilize our service. Okay, maybe next slide, please. As Rob mentioned, we've been around since 2007, but for a number of years, it was a service to our employee benefits customers. And it wasn't until a few years ago that I decided again to sell my benefits business and just focus on this full time. But as you can see, we've got companies for profit, nonprofit. We're right across Canada. We provide 24/7 support. And what we're really talking about today is executive programs, which is, I think, Rob, you felt that was the biggest need at this point. As Rob alluded to, and every day we pick up the paper, these are wait times in Canada right now. And the average wait time, so the average wait time in Canada right now, if you take the national average, is 27.4 weeks. So think of that. If you have a health issue, or your family member has a health issue, the average wait time is 27 weeks. And you can see how that compares to 9.3 weeks. I believe that was in 1993. So, you know, it just continually gets longer and longer. And that's really what our solution is provides access to the best, but also expedited access as well. Okay. And through the most recent Benefits Canada survey, this is really interesting because a few years ago, nobody even talked about health navigation, but 33% of plan sponsors are now interested in offering healthcare navigation. And when we talked about this a few years ago, nobody even knew what healthcare navigation was. So it's on people's radar now. 28% of employees said they would use a health navigation service. And we aren't just talking virtual health, which I think many of us have heard of. We're talking health navigation. That's somebody putting their arm around and getting them through the system. And also, plan sponsors are also interested in advanced testing, pharmacogenic testing, genetic testing, services to help aging parents, again, 35%. And these are all, the reason I mention that is that these are all types of services that we offer through our program. Okay. Next slide, please. So now I'm going to turn it over to Matt to get into our different offerings and what our programs are all about. So Matt?
Yeah, thanks, Kevin. So yeah, just to touch on kind of regular executive healthcare programs. So I think a lot of us on the call would have heard of, you know, MedCans, Cleveland Clinics, those in Calgary, maybe InLiv or Medisys or TELUS. You know, and these are great programs. We're not knocking them by any means because we're partners with a lot of these clinics. We send a lot of our members for their annual medical assessment. But the thing about it is there's, it's just usually a 1-day assessment, and really executives seem to treat that as an event. So, maybe leading up to the medical assessment, the executive eats a little better, watches what they drink, so on, and maybe they go in the gym a little more. But then once that, health assessment occurs, they're kind of back to their regular lifestyle. And so, it's a one-time event. It's not monitoring their health kind of throughout the year. And the utilization, alarmingly, on these programs is actually very low. I talk to a lot of organizations where they offer these medical assessments, which can be upwards of $3,000, like tremendous value. And executives don't use it, and they're not going for them because it's not something that is being pushed within the organization, or they can't find the time. So if you don't mind jumping into the next slide there, Rob. What we've designed at Advica is really more of a modernized executive healthcare program, where we really like to surround the executive and their family with a healthcare team and support them throughout the entire year. So we include these kind of elite health testing services like the annual medical assessment, but we also have a huge focus on preventative healthcare as well, which we'll dive into some more detail on later on. But the real big takeaway is that, we really like to support the executive and their family throughout the year. So now diving into some of the actual services in the executive healthcare, in our Advica healthcare program. Rob, if you don't mind just jumping ahead there. So virtual health is the first component. So maybe if you've used virtual health, you could put a number 1 in the chat, just to see kind of who's used virtual health before. Awesome. I'm seeing lots coming through. Okay, good stuff. So you guys are all very familiar. So, virtual health is a key part of our program. We provide 24/7 access to doctors. Middle of the night, you need a prescription, you need a lab requisition, you can call into our service and basically talk to a doctor within a few minutes from anywhere in Canada. And it's super valuable for kind of that in-the-moment care. And I actually worked in virtual health for 3 years at a company called Wello, was purchased by Maple. I definitely recognize some names on the call today from those days. But one thing about virtual health is it's great for those kind of walk-in clinic needs, prescriptions, lab requisition, specialist referrals. But where it kind of falls off is once you receive that, you're back in the public system. So if you could jump to the next slide there for me, Rob. So as we've alluded to, what Advica has really built is our personal nurse navigator and medical concierge. So, if you get a lab requisition or an MRI through our virtual health program or through your own family doctor, you all know that you get that specialist referral and you're kind of waiting. Months go by, you're not sure, are you going to get a phone call? Do you get a letter in the mail? What's happening? And so what our team does is we actually pick up that specialist referral or lab requisition, and we go back into the system and advocate on your behalf, provide updates to you. We'll use our nursing connections to try and get you in faster. And you'll see that stat at the bottom that on average, we decrease waiting times by about 65 days versus the public health system. Rob was nice enough to share his story, and we were able to get his son in within a few weeks. And that's kind of a lot about the feedback we hear in the market is the expedited care that we are able to achieve for our members. And so our mental health navigator is another component of our program that's really important. And, we all know mental health claims are increasing, continue to increase. There's a lot of talk about that. When we looked at the Benefits Canada survey this year, again, there was a lot of statistics on increasing claims in the mental health area. And what we find is when executives have a mental health issue for themselves or in their family, they want to look after it right away. They don't want to wait, months in the healthcare system to see a psychiatrist. And in fact, the average wait time in Canada to see a psychiatrist is about 22 weeks. And a psychiatrist is someone who can actually diagnose, treat, and prescribe for a mental health case. And so with our service, we're able to get you paired up with a psychiatrist within just 14 days, so within 2 weeks. So it's a lot faster than the public system. And we're able to get a second opinion for a mental health condition, review medication plans, We pair this with some of our preventative services like pharmacogenetic testing, where we can actually dial in what medications work with your genome. There's a combination of things we can do to support on the mental health side.
I think, Matt, if I could jump in for just 1 second, one thing that's important to note is you mentioned it, but I think it's really important to note when an executive or a business owner, it's someone in their family, especially has a mental health issue, it is all consuming. It is all consuming. Obviously we all care about our children and we all care about our partners and we all care about our family, however we define family. But when somebody in the household, shall we say, or the family hold, so to say, is suffering from a mental health issue, it is affecting everybody. It's imperative that health is delivered quickly and effective health care is delivered quickly.
Rob, if I can just interject to your point, because I think it's so important that, I think with any of our children or our family, when there's a health issue, that becomes the #1 issue. Like, forget our to-do lists or anything else. But we just had this week a situation where a business owner's daughter, unfortunately, had tried to commit suicide. They put her in, she was in the hospital, hospitalized, and 2 days later, she's out. And no supports. Time to go home. So fortunately, he's a member of our program. So he reached out to our service and now he's in touch with our psychiatrist and medical team and support and everything else. But basically he said, what do the public system, my daughter, they just let her go. They said, okay, after 2 days, you're fine, and dismissed her out of the hospital. So
yeah, don't do that again. Have a good day. See you later.
Yeah. So.
Awesome. And then second opinion navigation. So I think we're all very familiar with second opinion. The differentiation in our program is we have really high utilization, over 20% utilization across our member base with second opinion. If you ask our chief medical officer, when should you go for a second opinion, they say every time, because you never know if the medication you're on is working or if your diagnosis is correct, and it's no extra cost, right? You're part of this program anyways, no extra cost to you. Let's get a second opinion done. And we use doctors down in the States at some of the best hospitals in the world, Duke University, Johns Hopkins, Harvard Medical, for these doctors to review your case. And it can be really effective just to make sure a diagnosis is correct, as well as exploring some alternative treatment methods. So, there could be another route in terms of going under the scalpel for full-on surgery. We could be looking at some other options to optimize your recovery and your treatment. And so just to kind of wrap up our kind of core services, these are all the services that are included in the Advica Health plan, as well as some additional ones that we'll go into some detail here on the next slide. But this is kind of an oversight of our full program, and just to kind of encapsulate that, our team coordinates all of these services under one roof, which can be really advantageous because you might have some of these pieces placed within your benefits plan, but they don't talk to each other, and they don't talk to your family doctor, and they don't talk to the public system and the surgeon you're talking to. And really, that's where our team comes in to really bring it all together and operate under one roof. And so just to wrap up on my side is what the journey looks like from an executive standpoint. So just to kind of show you and put in your eyes what an experience with Advica Health would look like. So the first step in our process is we do an intake call with one of our nurse navigators. So this is a 60-minute call with our nurse, with one of our nurses, so very valuable. And this can be done with the executive themselves or the executive and their spouse, or they can do separate calls. And it's a phone or a video call where we can really understand your health goals, your health priorities, your medical history, any conditions you're currently dealing with, medications you're on, things like that, to really just build a picture of your health, as well as we want the executive to start to trust Advica and understand that they can call us for any of their health issues. We can handle their medical records, things like that. And then from there, we'll book an annual blend urine test. So, it's a really good way to just get a baseline.
Stop. It's okay. It's okay. Come here.
Just
Hey, Matt. Yep.
There we go. So yeah, just to get a good baseline of the executive's health, we'll send a nurse actually out to the home or office, so the executive doesn't have to go anywhere. We'll come and collect their blood and urine and really just get a good baseline of their health, see if there's any immediate red flags that we should act on. And then from there, we will explore medical assessment or a full body scan if, you know, that's something the executive is interested in or if they're a good candidate for that. So as I mentioned before, we're partnered with over 30 executive medical clinics across Canada to send our executives for assessments. We have preferred rates with all of them. So they're not just the kind of the street rate that you'd get. We have specialized pricing through our program. And then more recently, we're also doing a lot of full body scans or full body MRIs. You know, I'm not sure if anyone on the call has heard of a company called Prenuvo MRI. There's others that we're using as well. But it's a very popular service right now, and really what that's looking for is cancers and tumor growths. So we're able to basically do a 60-minute MRI and, you know, see if there's any tumors, and, you know, they can detect tumors when they're millimeters in size, which can be very advantageous to, you know about that and be able to act on something a lot sooner than when it's, you know, in stage 3 or something like that, when it's become a real big problem. And then from there, we also explore preventive health options. So Kevin will go into some more detail on that in a few slides here, but we have a whole suite of preventative health options that we are partnered with to support our executives with. So, you know, if you've ever heard of microbiome testing or food inflammation testing, pharmacogenetics, you know, a lot of our members have heard of these things. They're not experts in it. They don't know where to start. And with our program, we can give them an outlet to begin looking at some of those things or understand if they're a good candidate for those options. And then just to wrap up, the year-round support. So as I mentioned before, they'll have access to all the services we talked about before. We also offer, you know, US healthcare support. So a lot of our executives will go across the border for surgeries or MRIs or diagnostics. Because maybe they might have a second home there, or, you know, they live in Toronto, they can shoot down to Buffalo for an appointment or something like that. It can be very convenient. The problem is there's a high cost when you're going down in the States. So we actually have a price negotiation team to make those services down in the States more affordable. You know, a couple of weeks ago, we had a member who went down for an MRI and it was $300 and they had it the next day. I know personally, I would pay $300 for an MRI. If I could have it the next day instead of waiting in our public system for, you know, 6 or 7 months. So just examples like that where we can support from the US side of things. So Kev, I'll pass it back to you for the next slide there.
Hey, Kevin, you're currently muted.
Thank you. Sorry. Thanks, Matt. So Matt talked about preventative health options. So a lot of our executives, we have I'll say two types of members. One is somebody that said, you know what, if I have a health issue or I need your service, I will use your service when I have a health issue to help get through the system. But then we have a lot of other executives that say, you know what, I want to proact on my health. I don't just want to be in the norm. I want to do some advanced testing. So we put, I mean, there's a list longer than this, but these are just some of the more current ones that many of our members are using that are very topical right now. And Matt referred to a few of these. One of them is the full body MRI that Matt talked about. That's how, when I shared the story earlier about how we detected that business owner that had stage 1 kidney cancer, it was through a full body MRI. My wife and I go every year. We have a large percentage of our members that go every year. You would pay for that. But again, we get you a better rate than on your own, and we expedite the service because right now there's a 2-year wait to get in to get one of those. We generally are getting people in within a month for that service. I'll just talk about a couple of others here. Food inflammation testing. People don't even know you can get this done. It's a simple blood test, and this isn't and I'm sharing this for each of the people on this call as well, but a food inflammation test shows what is inflaming your system. And inflammation is the root cause of so many illness and disease out there, everything from cardiovascular disease, cancers, rheumatoid arthritis. And just to step back, inflammation is actually a good thing. If somebody punches you or You break your leg or something, break your arm, you want the blood, you want inflammation because that's helping you heal. What we don't want is chronic inflammation. And this test will show you what is causing you inflammation from the foods or liquids that you're consuming. And we've had people that have thought they've had Crohn's, they've had digestive issues. We've had people that have had psoriasis and eczema that have come off their medications simply by getting this test done. But again, and I just share this one test because we do all this testing, and a lot of this would come out as a result of the intake call that Matt talked about. For the type of executive or business owner that says, I really want to proact on my health. And you can see there's a bunch of other things there. Like we're doing things that people don't even know exist, like cancer screening. We're sending blood tests to Germany. It's called a liquid biopsy that shows if you have cancer cells circulating in your body. Most people don't even know that exists. So again, I'm just sharing these because it's our job to be in the know. Instead of you or your customers trying to figure that out, we know what exists and we know how to get people there and get them done quickly and efficiently. Okay. So just to summarize our gold plan, and Rob, I think when we went through this the last time, I mean, your comment to me sticks out because you said, Kev, what you've done is you've put all these different silos of services under one roof. So instead of people having to figure out where do I go and how do I get treatment and how do I get an MRI or how do I do all these different things, your comment to me was, we just reach out to Advica and you figure it out and get it done for us. And we will send out a one-page summary that you can use with your clients. But just to go through the services, and I'll go through them because I want to save some time for questions. But again, the core service is navigation. And navigation is we put our arm around people, help them through the system. As Matt mentions, it starts with an intake call with a nurse or medical practitioner for an hour. And most people can't even, we want to see our doctor and we're lucky if we can see them. And if we do see them, it's a 15-minute visit or 20-minute visit. And our whole process starts with a 1-hour intake call. A 24/7, 365 virtual call, as Matt mentioned, through virtual health. If you need prescription, I remember when our kids were young, once you'd go to the walk-in clinic. Now you can do that through virtual health, and then you'd have to go pick up the prescription. We offer prescription support and delivery. So instead of you having to go pick it up, we'll deliver it to your home. For all our gold members, we have a medical care concierge. So think of that as your travel agent for your health. That's your go-to person for your clients that they can reach out at any time on any of our services. Diagnostic imaging, that's MRIs, CT scans, ultrasounds, X-rays, whatever needs to be done, we're helping them navigate through that. Matt talked about mental health navigation. Again, we believe we're the leaders in Canada in that. An area that we believe is really neglected, and again, I think we're #1 in the country on it, is women's health. And women's health navigation, get advanced testing, often not even sure where to go. We know who to go to, who's the best, and this is right across Canada in every city. Matt talked about second opinion or expert medical opinion. Again, that's something that we do on an ongoing basis. A lot of people don't even have family doctors. We have a program called Family Doctor Search, so we will find people family doctors. The next two, access to our network. Again, we have over 1,000 specialists that we deal with across Canada and the US and worldwide. So when a member needs service, we help them plug into that. And again, it's not a referral. We're actually looking after them and guiding them to that option. I talked last slide about preventative health options. Matt talked about US navigation. So a lot of our members have US properties, or they travel down to the US, or they're snowbirds. While they're there, our program goes with them. So we help them, again, everything from prescription delivery to getting support to going to the hospital. We have members that are getting hip replacements, knee replacements while they're down at their place in Naples or Palm Springs. So again, this service goes with you while you're in the US. And as Matt mentioned, US price support as well. So not only getting the service, but we have a service that we use that brokers out the cost to make sure they're getting the lowest cost. Once a year, a lot of people don't even go for exec medicals, but once a year, we will come to your home or your work and do mobile blood and urine collection. So a lot of people, which is a great starting point. I mean, a lot of people don't even do that. They don't even think that. But once a year, and I have this done, I just had it done before Christmas, but once a year they come to your house, they do a blood and urine collection. And then Matt mentioned pricing for reduced pricing for executive medicals. Easy to connect. We don't care how people connect with us. I mean, there's a lot of virtual companies out there like TELUS Health that have now got into the health space. Most of our members still call us, email us. We're about, like your service, Rob, we're about putting our arm around people and helping them through the system, right? So we don't really care how people connect with us. And Rob, next slide. And so one of the questions, and again, we will send the slide deck out, but a lot of questions we often have is people say, well, I go for an executive medical. And what we've put together in this slide is to show you all the services that we provide through Advica Health, compared to an executive health clinic, compared to virtual health, because a lot of people think they're looked after through virtual health. That's only one small component of what we do. And many also think, oh, well, I can be looked after through my EAP program, which, as we know, is really around mental health. And so again, you can see the list of services through Advica Health in comparison to some of these other options that are out in the marketplace. And then I just wanted to share our programs. So we have 3 programs, and the one that we will send out to you, because I think, and it's the program, Rob, that you're on, and I think you have the most interest in, is our Gold program, which is traditionally what business owners or executives or their families would put in place. Many times people think our program is going to be $3,000 or $4,000 or $5,000 a year. It's very cost effective. It's $95 a month single, $145 family. And that can be put through the health spending account as an eligible expense, right? So
we can add it right onto their executive plan.
Yeah. So again, super easy to implement and not a huge cost. If you have clients or business owners under 40 years of age, we've developed a special program for them. And as you can see, mostly from a cost standpoint, $49 single and $89 family. Okay. So I know we've gone through that fairly quickly, but we wanted to save some time for questions and answers. So Rob, I'll turn it back over to you for that.
Matt, Kevin, thank you so much. I greatly appreciate it. And one of the things that's important to note, and I can't stress this enough, is some of the things that Matt and Kevin were saying about, full body MRI scan. If somebody wants that, fantastic. One of your clients wants that, fantastic. Through the system, you can get that navigation. Instead of waiting 12 months, you can get that done in a few weeks. And the cost is going to be less than what they would pay off the street. And all of that is an eligible expense under your executive plan. So how do we add value? How do we add real value? And it's about asking questions. It's not about you, it's about them. It's about asking questions and finding out, like Kevin said a few moments ago, what type of person are they with respect to their vision of their health? Are they proactive? Are they reactive? Well, this is a solution that can help both of those people, whether they're proactive or reactive. It's important for you as professional advisors to know what's available in the marketplace. It's about being creative. It's about, know your clients, as simple as that. And have a relationship and be that trusted advisor. There's a lot of opportunities out there, but it's about being that trusted advisor. It's as simple as that, right? And when we look at, adding value and adding real value, it's about leadership. Show your client direction. It's not about you being interesting. It's about being interested in them, right? And you've got to show your client direction, right? You've got to show your client capabilities. Talk to them about this program and other programs that are available, but know the stuff inside and out. Be an advisor and know the stuff. Show them your capabilities and show your client confidence. And it's interesting because I've got no problem selling this because I use it. I use it and I've had incredible success with it just with this one transaction. And it's amazing on how it works. Show your client confidence. It's pretty difficult to sell group insurance when you don't have it yourself, right? So show your clients confidence. Excuse me. So, when you add executive benefits, costs are going to increase without a doubt. Costs are going to increase, but you know what? The clients are going to be happy. So as Kev mentioned right off the top, it's not about, hey, let me show you a way to save money. It's not about saving money. It's about saving time. And this is a great solution to add value for your executive clients that are interested in this. And it adds an incredible amount of value because it saves them a ton of time and answers a lot of questions that are in that mental space. And this custom plan design, it works extraordinarily well. So you link this on or add it onto the chassis, if you would, this Advica Healthcare program that can be, just an incredible solution for your clients. And it eliminates the competition right out of the gate. Somebody comes along and says, hey, I want to, I can save you money and we can join the Sun Life plan. They can't duplicate this. They cannot duplicate this. It's as simple as that. It makes renewals easy. It makes the executive and the decision makers happy. And it adds, it's about adding value matters much more than finding the lowest cost. So increasing costs creates happiness and creates value, right? When done in the right way. So we've got 10 minutes left. We've got these spectacular experts on the call, Kevin and Matt. And we're happy to answer any questions. So let me stop sharing. First of all, I want to formally thank you both very much for participating today. So who's got some questions? Put up your hand and we'll get to you. Anybody have any questions, thoughts, idea? We've got 90 some odd people on the call. Nicholas Wismeyer.
Yeah, hi, Rob. How is it that Advica is able to get a psychiatrist in that case there in 14 days as opposed to, I think he said 22 weeks normally for the public system? That seems crazy, but anyways, thank you.
Yeah, so a lot of our services, what we do is we use third parties. So we use a private psychiatry network right across Canada that we then can plug our members into and we pay them, right? That's how we come up. Basically, we pay for all these different services through third-party providers, and then we're the ones that put the whole program together. So we pay, to answer simply, we pay for a private psychiatry network. And it's interesting because when I talked to the president of this company, his actual biggest beef is with GPs. And not to discredit GPs, but he says, in 15 minutes there's a diagnosis made and they jump to putting people on a prescription, an antidepressant or ADHD or whatever, without kind of going back to see what the root causes or the issues are. So to answer your question, we use a private network that then we can access and get our members in right away, like very quickly.
Thank you.
Who else has a question? Oh, we've got Matt Stewart. Welcome, Matt. Happy New Year.
Unmute myself.
There we go.
Unmuted? There we go. So my question was, do you guys, will it complement OHIP or is this a single pay for all uses?
Yeah, so definitely complement OHIP. Great question. When I first started the company, I thought that most of our members would want to go through the private system. So we developed relationships with Mayo and Duke and Harvard and all these private health institutions. But what I quickly found out is most people want to use the public system. So 99% of what we do is through the public system. We have private options available, as Matt said, for people that say, I'm down in Naples and I want to get an MRI, or I'm even in the GTA. I instead of waiting 2 weeks, I want it today. We can get a private option, but 99% of what we do is through the public system, through OHIP, or I shouldn't say OHIP, public health for every province.
Yeah, I was just going to say, Matt, on that note, with my son getting his knee operation so quickly, a 5-week wait or as opposed to a 18-month wait or whatever it was, it's done through the public system. Who else has a question? We've got a few minutes left. Anybody else have any other questions, thoughts, ideas? I know there's
something in the chat on commissions, so I'll let you speak to that.
Yeah, we pay commissions next. Simon, I'll get back to that in a moment. Simon, how many miles have you walked or kilometers have you walked this morning?
Well, I don't know. I haven't looked. 6, 7, I don't know.
Awesome.
What kind of age restrictions? Any age restrictions on there? So a lot of clients or high net worth clients that are 60s, 70s, 80s.
Yeah, no age restrictions. In fact, the majority of our clients would be 50 to 75 in that area. So no age restrictions.
Okay, cool. That's
Great.
good.
Thank you very much, Simon. And in answer to your question about commissions, there's a 10% commission for anybody that sells this, as well as that this is available to you through the benefits trust. If you've got a client with the benefits trust and you want to add this particular program on, we just link it right on to the chassis, so to speak, and the commissions are paid to you. It's not for everybody. It doesn't have to be for all employees. It can be for key employees. It can be for the executive group. It can be for whoever it is that the client decides that they want to make this available to. So the thing that I like about it is not, hey, it's $40 a month for everybody in the company. No, it's for, the executives that want this, or the people that they want to have covered, the groups within the group. So you can have it as few down to one life. And that's what we bring to the table as the TPA is able to make this program A, available, and B, pay the appropriate commissions and pay pay Kevin and his crew at Advica Health on a regular basis. Stuart Nam, you're up.
Hi, thanks for the presentation. Great information. Quick question. I guess I just put it in the chat, but I thought it requires a little bit more clarification. Does Advica Health do what we call a prehab program? And what prehab would be is based on the target demographic, 50 to 70-year-old. Everyone's going to need a hip replacement, knee replacement, or something along that line, because time is so valuable to these executives. If there is a prehab in place, what the ideal and goal of that would be to reduce the amount of time that they're away post-procedure. In other words, go in healthier, come out sooner.
So Stuart, great question. So yes, we offer full prehab and post-rehab. So pre-op, operation, post-rehab, and again, we know who to go to, whether it's whether it's massage or whatever's required. We would be able to access those services and guide them through that. So yes.
Great question. Thank you for asking. Sean, real quick, because we're going to wrap things up in about 4 minutes.
Yeah, thank you. I guess my question revolves around what's included in the service. It seems like this is more of a stick handling, advocating service. You mentioned the full health assessments. I assume that's not included, and that 90% is covered through sort of the public domain. But what of that 10% is covered under this plan, or is it all sort of funded out of pocket or out of the actual health spending account or current plans? Thanks.
Yeah, thanks, Sean. So majority of services that people access there's no additional cost for. So the ones that Matt went through, like virtual health, if somebody wants a second opinion service, any of our health navigation, our mental health services, blood and urine, it was on that one slide that I shared. So the only time people would pay additional is if they elect a private option. Like if they say, I want to go to Cleveland Clinic for an executive medical, or I want a pre-nuvo body scan. But as Rob mentioned, with those services, A, we can get you in quicker, and B, we have preferred pricing arrangements. So your a client's is always going to get a better price than if they went on their own to any of those services.
And C, it's all eligible through your executive plan with the benefits. All those expenses, Sean, are available through the as eligible expenses through the benefit plan. Kevin, real quick, because we got a few moments left, there was a question about underwriting and pre-existing conditions. Is there underwriting, and what about pre-existing restrictions?
No underwriting and no pre-ex. At one time we did have pre-ex, but what we find is when we help people, when they have a health issue, then generally people come in, and most of us have something that's going on from a health standpoint, and they're customers for life. So no pre-ex, bring anybody on as in their current condition.
We're going to stick around for a few minutes after if anybody's got any questions, but before I do my wrap-up comments, let's have a 2024 insurance industry. Thank you to Kevin and Matt Brady. Excellent presentation. Thank you very much. You added a great deal of value to us. And the question is, sorry, we've got a quick question. Can this be done as a standalone group? Not through us. It's got to be part of, an offering that we link on to, so to speak. And again, we can answer more questions if you want to stick around for a few moments. So again, thank you to Kevin and Matt. Thank you to, on behalf of all of us at the Benefits Trust and helping kick off 2024, our 30th year in business. Thanks to all of our team that have come out, Lindsay and Rob and Mike and Carrie. So thank you all very much. As well as that, great questions in the chat box. 95 people on the call today, which is exciting. Check out our website because we've got some Zoomcasts coming up in the month of February, and we're going to have them every single month throughout the year. We're also going to have a revised website to you very, very shortly. We've just signed off on that, and that's going to be coming live in the next couple of days. So we're going to have a new website for you to look through as well, and it's celebrating our 30th anniversary as well. Great questions, great discussion. You're going to get a CE credit for participating. You're going to get a CE credit for participating. You're going to get signed up for a newsletter. You're going to get a survey. Fill it out, send it back. Tell us how we did today. I want to give some feedback to Matt and Kevin as well. So please take a moment to fill that out when you receive that. And wish you all the best in 2024. Good selling, good advising, and we look forward to chatting with you soon. We're open for business and we've got inventory on the shelves. So we're going to stop recording right now. Thank you very much. And if you want to stick around, we're going to be around for a few minutes.